Senator Markey.
Thank you, Mr. Chairman, very much. And I just want to start by pointing out that we're holding this hearing on the 340B program and hospital finances in the middle of a healthcare shutdown in our country. Over the summer, the Republicans passed a bill to gut Medicaid and our entire healthcare system. Hospitals in Massachusetts are expecting to lose between $350 and $600 million over the next decade. I commissioned a report from the University of North Carolina that found that over 300 rural hospitals are at risk of closure or having to cut services because of that bill. The hospitals that survive will have to find a way to balance the books while caring for a surge in uninsured patients. And so now, on top of that, Republicans are blocking a continuation of the premium tax credits that help millions of Americans afford health insurance. The ticking time bomb is about to go off. Over 300,000 people in Massachusetts alone are finding out this month that their premiums are about to skyrocket, and many will decide that they can no longer afford health insurance. So Trump's Make America Sick Again agenda hurts families struggling to pay their bills and makes it less likely that a hospital will be there for them when they need help. So Dr. Feldman, thank you for joining us. Thank you for your work on the investigation that I led with other members of this committee on the extreme prices companies have been charging for inhalers. Our investigation led companies to lower the price of inhalers, a critical win for patients. So Dr. Feldman, you worked in Massachusetts for more than a decade, so it probably won't surprise you that more than 60% of them operate in the red. What impacts on hospitals and their patients can we expect to see if cuts to Medicaid and premium tax credits are not reversed, especially for hospitals already losing money this year?
I think we could see really devastating effects on the health of patients in Massachusetts and in other states in our country. I think we could see less screening. We could see less management of blood pressure, less diabetes care. We could see more hospitalizations for heart disease and for respiratory disease. So I think that you're absolutely right to point out how these cuts will translate into health losses and how hospitals in your state and other states will bear the brunt of patients losing their insurance coverage.
Yeah, thank you. Well, we know that the Republican bill, as it was passed, is going to have a dramatic impact on Medicaid. It's going to force Medicaid work requirements, which we know are just new paperwork requirements nationwide. And last month, the GAO issued a report on Medicaid work requirements in Georgia. Ms. Rosenberg, how much did GAO determine that it costs to administer these onerous requirements?
We found that between fiscal year 2021 and the second quarter of 2025, Georgia spent about $54 million on administrative spending for its work requirements demonstration.
Yeah, so that's $54 million in just one state spent on red tape instead of on making Americans healthier and lowering their bills, and that's just wrong. It's just absolutely an inefficient way of dealing with all of these issues. Dr. Feldman, back to you. If someone loses their health insurance because they were unable to complete time-consuming and complicated forms, how would you expect that to impact their health? Would that make them more or less likely to be able to find and to keep their job?
I think that it could have bad consequences for their health, and it could make them less likely to be able to work. I think about somebody, for example, who can't afford their inhaler, who isn't taking the maintenance therapy that is prescribed to them, who then finds themselves dealing with a COPD exacerbation and out of work, unable to contribute.
Yeah, thank you. Preventative health care is a moral imperative. It keeps families healthy, patients out of the emergency room, and health care affordable. Community health centers are key providers of preventative and primary care, and 340B is crucial to health centers trying to keep the lights on. Dr. Feldman, can you share from your experience as a physician what happens when patients are unable to access primary care in their communities?
When patients can't access primary care, they end up in the hospital. They end up, for example, I think about a patient who I saw in the ICU from an overdose, from an opioid overdose. And how does somebody land in an ICU following an opioid overdose? They may not have had treatment for their addiction. There are also all sorts of health conditions, of problems that arise years later because you didn't get the cancer screening that you needed, or because you couldn't treat your high blood pressure, which results in heart disease down the road. So I think you have immediate effects of loss of health insurance coverage. You have far downstream effects that can be equally as problematic.
Yep. And again, Yale University is saying that 50,000 people a year are going to die because of this reduction in health care coverage. Thank you. Thank you, Mr. Chairman.